Hello. I know I'm going to be upsetting a lot of people today, especially the proponents of cannabis. It has become a recreational drug these days. But the point of this video is to look at cannabis and how it is viewed under Western medicine, which of course a lot of people say, oh, Western medicine propaganda, that's why cannabis was blocked. I get that, I hear you. But we go deeper in and we look at traditional Chinese medicine and how that views cannabis, and Ayurveda and how that views cannabis. Now, there's a lot of detailed study both in traditional Chinese medicine and Ayurveda well before Western medicine looked at cannabis. And its properties are well defined, its impact on body is well defined, and that's what I'm going to drill deep down in. Now, I'm not against it, I'm not pro it. I'm just sharing what we've come across in our research. As you know, we have a team of doctors, both Eastern and Western medicine doctors, that are doing research on medications under escape aging to find potential cures for some long-term diseases. And I'm really thankful for everybody's support that has been putting in all their effort financially and intellectually towards our research. Now, getting back into my topic today, which is cannabis and how it is viewed in traditional Chinese medicine, Ayurveda, and Western medicine. Is it healing or is it harmful? Now, before we get into cannabis, let's have a look at what it has. It has cannabinoids, it has two elements to it, which is your THC and the CBD. The THC is the psychoactive substance in it, and the CBD is the non-intoxicating element of the cannabis. Now, basically it interacts with our endocannabinoid system, affecting mood, pain, sleep, and appetite. And that's why, it's considered great, and a lot of people, I've spoken to some of our volunteer patients, they have gone and been part of clinical trials who came from post-war syndromes, major life events, people that have had serious physical injuries and lived in pain, and they have shown cannabis has worked wonders for them. One of our test subjects was in a very horrific war, had a lot of injuries, was tortured for years. So not only had he impact from the mental agony that he faced from 2.5 years in prison and torture, but also from the physical injuries this person had. And of course, cannabis used to help him a fair bit in pain management. So that is understood, fairly well understood and documented in Western medicine. Now, getting into Eastern medicine and correlating with traditional Chinese medicine, what is cannabis? It's considered to be cooling, dispersing, and descending. So essentially, when you have pain, you have anxiety, you have a rush of emotions, we've discussed this in other videos as well, it's a rush of energy to your head. Now, what cannabis is doing is it's cooling, dispersing, and descending, which means it does bring your energies down. It does cool you down. So it may calm the shen, which means it may calm your mind, relax your mind. I'm saying may, and this is not medical advice. You need to refer to your own healthcare provider for that. So I'm not a proponent of using cannabis by any ways, but that's what TCM says. It releases stagnation. But then it clearly states that it's only in very, very small dosages. It cannot be taken regularly. Now, if it is taken regularly, what it does is it damages or weakens your spleen qi, leading to fatigue. If it's taken in form of edibles, and if it's overdosed on edibles, it'll lead to fatigue, it'll cause bloating, it'll cause heaviness, it'll cause brain fog. We have test subjects that have taken edibles beyond a certain quantity, and then they've seen their GI system completely stop, digestion stop, they've become severely constipated. In extreme cases, they have repeatedly thrown up. So it can have some very serious consequences. And the problem is people use it these days, especially in the West, since it's being legalized, almost as a recreational drug. And they're like, oh, it's better than alcohol, but it doesn't damage your liver. I get it, it doesn't damage your liver. But it has other impacts which are building up in your system. And there's just not enough studies or not enough patient pools to start showing the negative effects of it. But when I see teenagers, people in their early 20s, walking down the path every day, they want to have a joint. They're essentially destroying their chi. It is not a building herb. It is not some kind of nutritious herb that is, building you. Like, it's not something like goji berry. It's not something like shilajit in Ayurveda. Those two are very strong herbs and are used in moderation. This is more of something similar to a Tylenol. You're taking it in small dosage. Yes, it's helping you. But the moment you build the dosage, for example, Tylenol, you keep having a lot of Tylenol, you're going to wreck your liver. Same thing, we are not wrecking the liver here. Well, your spleen chi is getting destroyed. Well, if your spleen chi gets destroyed, what happens is your kidney jing gets depleted. How? Because what happens is your kidneys have to work much harder. This is under the TCM philosophy. Because kidneys basically have to warm the middle jaw, which is your middle burner, which is your digestive system in the Western medicine context. So your stomach and your spleen. So essentially, it's a downstream effect that's happening. Then, because it's constant descending and dispersing regularly, it's going to start playing up with your mind. Instead of calming the shen, when you become dependent on it, your body stops working within its own built-in mechanisms to calm you. Rather than going and doing a HIIT workout or going for a run or playing a sport or swimming, you start becoming more dependent on something external, which is supposed to be a one-off, a temporary relief. I won't even call it a cure. Becomes a dependence. And just because, it's Mother Nature's gift, and the whole colloquial acceptance in popular culture of cannabis has been popularized that people just tend to accept it. So bear that in mind. Now, when we go and look at Ayurveda, that reinforces what it's already been said in Western medicine, what's already been said in traditional Chinese medicine. Ayurveda basically calls cannabis Vijaya. It says heating, drawing, and penetrating based on how they deduce it. It reduces kapha, but increases vata and pitta when overused. Now, most of Ayurvedic doctors would actually be able to understand what I'm saying, but it says that it may aid in digestion a little bit, but once it's overused, it will block your GI system. And then it's going to deplete the ojas, which is essentially, ojas is something that is your core vitality. It's your immune system. It's equivalent of your jing in traditional Chinese medicine, which is basically your essence. You continue having cannabis on long-term basis will result in ojas depletion, which means your long-term ability to fight disease, your ability to stabilize your mind and your motivation, your ability to deal with your fight and flight reactions will be lost over time. You would see that your anxiety levels or your threshold of anxiety is going to drop. Your resistance against triggers that would make normal people anxious would lower. You would become anxious quicker. So it's essentially the same thing that we've discussed in Ayurveda. That's what traditional Chinese medicine says. That's what Western medicine also says. I mean, there's a lot of studies being done in treatment of epilepsy, for example, where it's been very, very useful. But again, Western medicine also says the same thing. Results in cognitive impairment, dependence, psychosis in many cases. So, if you consider and use it, and those people that use it, I strongly recommend not to use it, because there are better things out there. There are better herbs out there that do not form dependence. 5,000 years ago, the ancient Chinese, the ancient Indians knew about this, and they also knew much better herbs out there that are available on this planet that do wonders in terms of building strength. At Escape Aging, what do we always say? We say that you want to build strength from within. You want to build a system that's strong. You don't want to rely on crutches, because using cannabis is like relying on crutches. Short-term relief. Yes, you've got a massive headache. You want to take a Tylenol. You want to take a Panadol. You want to take an Aleve. I understand. But if you make it a habit to take that every day, that's a problem. You need to figure out what's driving those triggers of the headache instead of taking Tylenols regularly and then working backwards and going, okay, I need to change certain patterns in life, whether it's food, whether it's sleep, whether it's just my lifestyle. So same thing with the use of cannabis. It needs to be treated with a lot of caution, extreme caution, and ideally avoid it, because there are so many better herbs out there that you don't need to smoke. So you're not essentially taxing your lungs on that. You're not impacting your lung chi, and they have a building component to it, which is making your body stronger from within. So until next time, whether you like it or not, think twice when you are smoking weed or you're having an edible, and think, do I really need this, or can I do without it? Thank you.